Oh, thank you. Okay, so good morning, everybody. This morning, we're going to be talking about the Westchester County Department of Community Mental Health. This is our overview of services. I will tell you this is a lot of information that's going to come at you at once. We will do question and answers later. We are live streaming this so that it can be recorded and saved on our COC website. So you don't have to scurry to take notes and stuff. It'll all be there. And one of our main things that we want to get across to folks is that if you do have questions after today, please reach out and contact us at DCMH. So my name is Annette Peters-Ruvolo. I am a program director here for the Adult Mental Health Unit here at DCMH. I also had the privilege of being the COC co-chair for about 10 years before Craig Wong took over that position. So I'm trying to keep in mind the importance of making sure that this information is relevant to our shelter and housing providers first and foremost. And then, of course, there's lots of general information for just about anybody who comes across this training. So welcome. If you can hold your questions till the end, that would be great. If you chat them throughout, I may not be able to get to them till later. Just so you know, that's sort of how we're going to flow. And if you have joined us but not put your name and agency in the chat, if you're able to do so, please do so, because we are taking attendance. So the Westchester County Department of Community Mental Health is a branch of Westchester County government, and our responsibilities include coordinating services for people with mental health, intellectual and developmental disabilities, and SUD services. And what we do is DCMH acts as the liaison with state and federal agencies and provides planning, funding, and oversight to ensure comprehensive service provision throughout the county. So you'll see here, there's DCMH, and we have 6 different units within DCMH. There's the adult mental health, children's mental health, substance use and addiction, which is across the lifespan, intellectual and developmental disabilities unit, also across the lifespan. And then we have 2 other services here. We're not going to talk too much about them. Our employee assistance program is an employee assistance program that we here at DCMH provide to county employees. Plus, we do have a few limited contracts with some other entities outside of the county, but it's not an employee assistance program like for the world. It's for special populations and under specific contracts and for county employees only. And then we have TASK, which is our Treatment Alternatives for Safer Communities program, which provides case management and information and referral and assessment for court mandated folks. So they're referred directly from the court system. So we're going to touch on that a little bit, but not too much, because my understanding is that you probably have worked with people who are working with TASK, but it's not something that you can refer to on your own because they're court referred services. Here's our agenda for today. We're going to talk a little bit about crisis and more general behavioral health services, as well as adult mental health services. Then we'll talk a little bit about addiction services and supports, then mental health services and supports for youth and families, and intellectual developmental disability services and supports, including how you can access all of these different kinds of services and supports. And right off the bat, what I will say is that we do provide some direct service here at DCMH, but the large majority of services that I'm going to talk about today are ones that are contracted with our subcontractors or provided through either hospitals or other agencies or entities that contract directly with the federal government or the state, but are being provided here in Westchester County. So accessing crisis services. So the most important thing that we want people to know is that as of July 2020, the new National Suicide and Crisis Lifeline is just 988. Similarly to 911, anyone can call that number from anywhere and receive assistance. The exciting thing is that prior to July, when someone would call the suicide prevention hotline, the National Lifeline, before, the calls were being routed sort of regionally, but not locally. For example, anyone who called from Westchester, the calls were actually being answered up in Syracuse. So in order to make things more local and provide more local assistance, these calls are now being funneled to St. Vincent's Hospital's crisis network team, which was established specifically to respond to 988 calls. They don't do anything else. They are not part of our crisis prevention and response team. They are a separate team. Of course, those two teams work very much together, but the crisis network team is really there to respond to 988 calls. I also want to point your attention to their the 988 website, which is, it's not just 988 because you'll get like a bazillion different things, but if you type in 988lifeline.org, it will go to the 988 website, which has an immense amount of resources and information, and it has a chat capability. There's also a texting capability for people to be able to reach out. And it's really quite impressive, the amount of information that's there, but it's also sort of, it's not an overwhelming amount. I think they did a good job in presenting the information really so that any person anywhere in the country can get information that they need about suicide prevention and crisis, or to prevent a crisis. So feel free to call that number, give that number out, and get comfortable with that number, because it's really a great resource and one that we're very proud and happy to have and have a local connection to. And of course, this is something that's for everyone. It's not just for mental health providers. It's not just for your clients or the people that you're working with. It's for anybody, family, friends, yourself. So that's 988. We also have the New York State Substance Abuse Hope Line. That's a New York State line that can connect people 24/7, 365 to any kind of substance abuse or substance use services or information. And you can also text to that number. Another local resource that we have, which I just mentioned, is the Crisis Prevention and Response Team, which has been around for almost 10 years now, I think. And that is a 24/7, 365 service operated by St. Vincent's Hospital, where they provide support, info, and referral, and can arrange for clinical assessment at St. Vincent's or in the community. So the 988 just pretty much adds to our capabilities, but we still also have the Crisis Prevention and Response Team. I also wanted to bring your attention to the new initiative that we have, which is called Project Alliance. The Project Alliance initiative is about, I think, a 7-pronged approach to the reimagining of law enforcement in Westchester County. And part of that is the establishment of mobile crisis response teams. I want to remind everybody, of course, that 911 can also be called in any emergency. And to assist 911 in the 911 process, we have established 8 different mobile crisis response teams throughout Westchester County. And these teams actually sit in police departments, except for the one in Mount Vernon, which I'll talk about in just a second. These are the providers that are working with us to provide those teams in those various police departments. We also have staff here at DCMH overseeing these teams. And their purpose is to assist law enforcement as 911 calls come in and try to address them appropriately and in the most effective manner, because as we all know, sometimes people call 911 and it's really a mental health or behavioral health issue as opposed to a law enforcement issue. And sometimes teams will go out on their own. Sometimes they go out with law enforcement, and that gets determined as the calls come in. So DCMH has trained every single police dispatcher in Westchester County to know how to triage these kinds of calls and know when to send calls to the MCRTs. And the MCRTs are being staffed 24/7 and working with each of these departments. In Mount Vernon, they recently, in the last couple of years, launched their own police department wellness division. So our mobile crisis response team sits at the Guidance Center of Westchester offices, which are also located in Mount Vernon, but they're not sitting at the department as the other teams are. The important thing to know is that you can't access an MCRT yourself. So please don't ask me, how do I call an MCRT? The way that the MCRTs are accessed is through 911 response. So general services. So everybody knows we have lots of mental health outpatient services. A lot of people would say we don't have enough because there are certainly a lot of wait lists and a lot of issues around getting people in for services, which we understand here at DCMH. But we do have, I just want to point out to you the hospitals that have not only inpatient services, but also outpatient. Also, there are a number of clinics, outpatient clinics throughout Westchester County that some of them are a little more child focused than adult focused, but all of them are Article 31 New York State Office of Mental Health licensed clinics that we here at DCMH oversee. And the reason why I'm just sort of like listing them is because I'm going to, in a moment, point you to our service directory, which is an online directory that, that has all of the details about all of the behavioral health services in Westchester County. Other adult mental health services that are out there are a lot of different specialized outpatient mental health services. So when I say on the last slide, I mentioned clinics. A clinic, as you know, is like a therapist and a psychiatrist. Sometimes they do groups, sometimes they do individual services, but it's usually once a week or maybe once a month for the psychiatrist and once a week for the therapist and maybe once a week for group. We also have a more intensive services and varied services like the PROS program, which there are 2 PROS programs in Westchester. PROS stands for Personalized Recovery Oriented Services, and there's one at St. Vincent's and one at the Guidance Center in Mount Vernon. And what those PROS programs are about is person can pick and choose what types of groups and what kinds of sessions they attend. They have to build a curriculum around their treatment plan with their therapist. So they can get clinical services there too, but also they have groups and workshops around vocational issues, socialization issues, all kinds of things that people might want to work on. The difference being in the old days, there were a lot of programs where someone would be dropped off at 8:30 in the morning and be picked up at 2:30, and that was their whole day. PROS doesn't operate like that. It operates on the assumption that the client can choose for themselves what kinds of services that are going to be useful for them, and then they can change that. We also have partial hospitalization programs, which is sort of like you go for a few hours a day kind of thing, and it's usually used as a step down from an inpatient stay. Most of our clinics also have intensive outpatient, which is a therapist and a psychiatrist, but typically more often you may see the therapist 3 times a week and go to groups as opposed to doing just 1 day a week. And we do still have one traditional day treatment program, a continuing day treatment program through Phelps Hospital, which is the type of program where the person goes for the entire day and gets all of their services in one spot. We also have a lot of peer and non-clinical support programs now in Westchester, we're excited to say. I know that some of our shelter staff have worked with HDSW's Living Room, which is like a respite kind of program where they have, well, I hate to lead off with snacks, but they do have snacks. I believe they also have a shower. They have comfortable living space and places for people to relax or socialize or get support. And they are open every day. They do ask, because specifically because of COVID, they ask that people call first to before someone drops in, although they will take drop-ins if necessary. And also we have psychosocial clubs in Westchester County. We have MHA of Westchester Sterling Club and HDSW's Hope House, which operate as psychosocial clubs, but they also, most psychosocial clubs also have their vocational type programs within those clubs. So they do a lot of different kinds of things. There's groups, workshops, there's opportunities to get into vocational programming, etc. We also have the RISE Center, which is in Mount Vernon, that's run by the Mental Health Empowerment Program. And they do a lot more of really support and advocacy type services. They were doing acupuncture. They also have a lot of stuff going on online as well that they launched during COVID. So they have support sessions happening, I think, daily. And they send out a calendar every month of things that they are doing. And then there's also the Center for Career Freedom, which offers really any kind of, for lack of a better term, technological assistance that someone may need, they can do with someone on an individual or on a sort of classes basis. They do everything from helping somebody work with their cell phone if they get a smartphone. They can do things like helping people to set up Zoom for their iPads and things so that they can communicate, connect with people. They also do Excel classes, Microsoft Office classes, medical billing training, those kinds of things. And that's not an exhaustive list. That's just a sort of a sample of some of the things that are out there. And when you are, one note I want to make is when you are referring folks for services and you're trying to find the best fit, it's always a good idea to ask whoever you're talking to for information or referral, or the intake person, if they have any, make sure that they know if the person falls into any kind of special population. So, because some of our providers have resources that are set aside for people who have been adversely affected by COVID, or if they are veterans, or if they are HIV positive, or if they are survivors of domestic violence. It's always good to point it out and see if they have some kind of special program. Obviously, with anyone who identifies as serving in the military, we want to be able to guide them to the VA for assistance first, because they have the most services for veterans, and most specialized. However, we also have a lot of veterans who may not, for whatever reason, want to engage with the VA, or may not be eligible for VA services. That we have, many of our providers now have special programming just for veterans, and may also have funding for those programs. So the issue of insurance should not be a hindrance in terms of getting services, particularly for someone who fits into some kind of special population. And off the top of my head, I know that FSW and MHA are two providers that do have specialized services for veterans and their families. Okay, so what does DCMH actually do? I've talked a lot about our providers and the different kinds of services that are out there in Westchester. But What you can expect by contacting DCMH's Adult Mental Health Unit is information and referral for any of the kinds of services that I just talked about. We're going to talk a little more about SPOA, the single point of access process. We're going to talk a little more about that in detail in a little bit. We, of course, also do community education and training. We also have, and you're going to see a pattern here. We do a lot of forensic care coordination and mental health alternatives to incarceration. We participate in mental health court and advocate and support folks through that process. We have a parole reentry task force and program. We also obviously do a lot with police and mental health outreach. And we have the Fresh Start program, which is a fairly new program that is it's a group modality that assists people who, after their first time arrest, and are referred here again through the court system. So the majority of these services that we do directly with individuals are ones that are referred to us from either the jail system or court system. But, you know, that doesn't mean we can't take on a case from someone who has that in their background but isn't being directly referred. We may be able to do that at times too, using the SPOA application for case management. So let's talk a little bit more in depth about the SPOA process. So single point of access is a New York State Office of Mental Health construct that every county in the state of New York has to have a SPOA process in order to, and it's really to allow counties to make sure that those that are most in need are receiving the most intensive and specialized services that the Office of Mental Health can offer. Those include ACT, which is assertive community treatment that's available through the SPOA application. Care management, which I just want to clarify that the difference between there's health home care management, which is Medicaid billable, and that's through the New York State Department of Health. That's how that's billed, and that's how people are enrolled, versus non-Medicaid case management, or sometimes we say care management also. But the time that you would use a SPOA application for case management is if the person does not have Medicaid, because we here at the county, we oversee the non-Medicaid or non-billable care management slots in the county, whereas the Department of Health now oversees all of the health home care management. And if you have a client who requires care management and has Medicaid, but that hasn't been assigned to a health home yet, or has been assigned or isn't sure if they're assigned, it's the best way to get them services is to contact a health home care management agency or the New York State Department of Health to see who they have been enrolled with. Because generally folks have been enrolled automatically, but the provider may not have been able to find them specifically, and especially if they're transient and move around a lot, obviously they don't catch them. And so they, on paper, look like they're enrolled within a health home, but they're really not getting the service. And again, if they don't have Medicaid, then you'd want to use a SPOA application for that. The newest set of services that we have added to the SPOA application are called community-oriented recovery and empowerment services. These are specifically for individuals who are health and recovery plan or HARP enrolled. The way to know if someone is HARP enrolled is to contact the individual's managed care organization to determine that. The services that are available through these core services include mobile therapy, skill building, peer support, and family support. They're very person-centered and designed to assist the person in whatever goals that they have to be successful in the community. And of course, the one that you guys know the best is that housing services. We also use the SPOA application. The housing services that are included in the SPOA application are community residence, which is the most restrictive living environment that we have to offer in this county through the New York State Office of Mental Health. So what that means is a community residence is, for lack of a better term, like a group home. It's congregate care, where usually between 8 and 10 adults live in a house with staff that are there 24/7. It is not a locked kind of unit. It's not that, it's not like that. But there is oversight of people taking their meds, and they usually eat meals together, although they don't always, and people can pretty much come and go as they please, but they need to have plans. And of course, they need to adhere to the rules of the house. The next level is called treatment. Well, we say treatment apartment, but technically it's apartment treatment, which sounds more like a dorm kind of thing. They're individual apartments in the community that have usually 3 or 4 adults living there together, and they share common spaces. Staff are not there 24/7, but they are accessible. And they do visit regularly. And that's sort of like the midway point. And then of course there's the supported housing, which is your own apartment in the community. A lot of the standards that they use for Section 8 are employed. It's 30% of the person's income, and the New York State Office of Mental Health subsidizes the rent and the services that go with those units. And then we have the ones that you guys are probably most familiar with, which are our HUD SPOA slots, which look very similar to our New York State Office of Mental Health supported housing, except that the person has to meet the criteria and eligibility of HUD's definition of homelessness, which is different. So our New York State Office of Mental Health supported housing waitlist has hundreds of people on it, and it's an extremely long wait. It could be up to a couple of years for that kind of slot. The HUD DCMH SPOA slots tend to come up a little bit quicker because the person is meeting the HUD criteria. They also have a SPOA application. And even though our turnover is very low, the wait is typically not as long. But what that means is that the person needs to meet SPOA criteria, plus also meet HUD criteria in order to be enrolled in the program. And that's also done through the SPOA application. DCMH does also have a few. We don't have nearly as many non-SPOA slots as we do SPOA slots, but we do have some where we've been able to house folks into permanent supported housing that do not have a SPOA application. DCMH staff can also assist with the assisted outpatient treatment petition or REP payee services, which is representative payee services. And you don't need a SPOA for either one of these things. The way that you access, well, let me explain what they are. Assisted outpatient treatment is a court-ordered treatment plan that the client and the community needs to follow. There is a time limit to it, but it's court mandated, and it has to be there has to be a psychiatrist. Typically it's a hospital that puts the petition in, but DCMH tends to work very closely with the entity who's submitting the petition for that AOT request to go in. And they are time limited, but then they can be renewed if necessary. So once someone has an AOT, there's a constant feedback loop between DCMH and the team working with those individuals to assess and review where they're at with the petition and whether it will be renewed or ended after after the period is done. And then representative payee services, most of you, I think, are probably familiar with that. That means that there's somebody, an entity or an agency. Sometimes, you know, there are folks who have family members who are their rep payees, but if that's not a possibility and the person requires rep payee services, you can contact DCMH, who works with, we have a direct contract with MHA of Westchester to provide rep payee services. And we also work with APS because they have a direct contract with FSSY for rep payee services, where the agency pays the person's bills and provides the person usually with some kind of allowance, either once or twice a month, to be able to have spending money as well. Typically, those folks are also involved with a care management or case management program, so that there is someone who is sort of the mediator between the client and the rep payee agency. And I have at the bottom of this slide the DCMH staff to be contacted for those various types of services. Okay, so what I alluded to before is that we have a directory of community services, which is available online. Right, yesterday, I did a video on how to use the online directory. So please go to our COC YouTube channel for a demo if you need one. You can just go right to the site, and if you read the instructions on the main page, you could probably navigate pretty well and figure it out. But just in case people get stuck or they like to watch videos about how to use directories, please feel free to go to our YouTube channel and check that out. And what it allows you to do is you can search in a lot of different ways. You can search the directory by the name of the agency, by the name of the program, by the type of service being delivered, and then or by using the map. So, and the map, you can either type in an address, or you can just plot it on the map, or you can do like a near me, and set your location so that you can see what's around wherever you are or wherever the client is. And that can be done on your phone or your laptop or any of those. Okay, so I'm going to jump to substance misuse and addiction supports, and how to navigate prevention and treatment services. So what our DCMH Substance Use Division does is they provide planning and oversight of the following types of SUD services: prevention, treatment, gambling, and recovery supports. The large majority of the contracts that we have are for providers who do either prevention or treatment, and then some do both. And then some are specifically for gambling programs. And then recovery supports tend to be other supports that are in the community that we may not be funding, but we try to have oversight of. This slide just talks about what prevention programs are, but I think you guys probably know what prevention programs are. A lot of them are in schools. Most of them are geared toward children aged 8 to 21, but there are other prevention services across the lifespan. Here in Westchester, a prevention program may look like an education type program where you're trying to educate parents through the schools and educate children on the dangers of smoking or drinking or those kinds of things. They also tend to look like evidence-based strategies where you're trying to promote healthier living, healthier choices, and giving kids and teenagers alternatives to using, which may look like a community center having a game night or having a basketball tournament or things like that, where you're where the message is really, choose this as opposed to choosing alcohol or drugs. And then treatment is probably what we are most, the ones that we are most of the time referring to and talking to our clients about. And these are all New York State OASAS, which is Office of Addiction Services and Supports programs. And they include medically managed detox programs, which are typically through a hospital, inpatient rehab programs, medication assisted treatment or MATs, and MMTP type programs, which are methadone maintenance programs, which is opioid treatment programs. There's also outpatient programs, which are day rehab and clinic services. And there's also residential programs here in Westchester. Some of them, of course, are outside of here. We know folks that may go up to Putnam County or even farther north for residential programs for a 30 or 45-day stay and then return to our community. Gambling is separated out because it has been getting more attention throughout the state. My guess is because now I guess online gambling is legal in the last few years, and in our county and our state and some of our surrounding states. And they do have outpatient services, as of course prevention and treatment services. Some are group-based, some are individual, and they also have family counseling. So a lot of our services that provide, a lot of our agencies that provide treatment services can do gambling treatment services as well. And then there's recovery support. So as most of us know, recovery from addiction can be a lifelong process. And New York State OASAS funds regional support services like youth clubhouses, recovery centers, which are safe spaces that allow community and skill building for those that are in recovery. There is a clubhouse located at the YMCA of Yonkers that provides non-clinical pro-social activities, educational, vocational support, and a drug-free environment. And of course, throughout Westchester, we also have peer programs such as AA and NA and those types of services as well, or programs, I guess I shouldn't say services. And we also have a program through the Westchester Independent Living Center that does recovery support as well. There are also harm reduction programs which incorporate a spectrum of strategies that includes safer use, managed use, abstinence, and addressing conditions of use along with the use itself. Many of our programs provide harm reduction interventions and services such as Narcan, which is the opioid overdose medication, trainings, and the distribution of kits. So I have on here Trevor Payne, who's our program director, and Susan Manzione, who's our other program director of our substance use division. They're both here to help and help agencies as well as individuals. I know that they work very closely with our Department of Health in providing Narcan training and kits. I know they've done a slew of trainings across the county for agencies or for shelters or for groups of agencies. However you guys need it, we can accommodate that. And if you've had training, but either your kits are expired or you have new staff that need to be trained, please reach out, because that's something we definitely want to make sure that we stay on top of, because we found that Narcan works and it's fairly easy to administer. And it's an effective way to save someone's life. It's kind of that simple. And then we have a chance to really work on hopefully getting them into some kind of treatment or on the road to recovery from a situation like that. Okay, so youth and families. So those of you who are working in our family shelters know, and in our housing, our family housing providers as well, know that families, as complicated as working with adults are, sometimes working with families can be even more complicated because there's just more people that may have more needs and more things going on, and children who are in school or in high school are transitioning, and whether they have special needs in addition to those things or not. There's just a lot more going on when there's a whole family household that you're working with. So we're going to talk a little bit about how to navigate the children's mental health system. This graphic, as you see, has a continuum, and this arrow goes both ways. So that means there's no wrong place to start. There's not any way that you have to do this or that your families have to do any of this. It's just a way to show that our services are on sort of a continuum, that we have very sort of natural, informal supports, and it goes all the way up to crisis services. But of course, we may start with families who are in crisis and then put in some of these other services. So what we may start with are things like, or what we may want to look at, or what you may want to look at is working with families, is what natural and informal supports are there. You may have families who are either involved with outpatient therapy or need to be, or would like to be. And that may take the form of either private services, clinic services through clinics, or school-based satellites, which a lot of our providers also have school-based satellites. There is our children's single point of access, which I talked a lot about the adult single point of access. There is also one for children's services, which has the same goal, which is to make sure that the most highly specialized children's mental health services are being provided equally and fairly. And that's why we use the single point of access process. But through that, and sort of as part of that, even if you're not sure if a child or a family is eligible for SPOA, or if you have questions about what makes a child eligible for SPOA services, what kinds of services are included in SPOA, please call us. There's a phone number there, 995-5352, and we can provide consultation, help with navigation, something called a wraparound meeting, which is like a support meeting of all those working with the family, plus the family is there as well to talk about different options for services. And then linking to intensive in-home services is one of the points of having a SPOA for children. There's, of course, inpatient hospital options if needed, and residential treatment. Some of those residential placements are done through the school district, and some are done through the New York State Office of Mental Health directly. So we have a lot of information on those types of services. And then, of course, the crisis services, which we talked about already, St. Vincent's Crisis Prevention and Response Team, as well as the 988 number, are there to help with children and youth services just as much as adult. So I did talk about this a little bit, what our children's SPOA, what it does and what is the role. And the most important thing is that there is no wrong call. So you don't have to worry about, well, is this the right kind of call for children's SPOA? They're all the right kind of calls, because we want to know what's happening with our families and whether or not we can be helpful in terms of working either with individuals in the family or the family unit itself. And a lot of the focus of our youth and family services center on the youth and family voice. So we have a SPOA family support specialist here who has lived experience and can provide non-judgmental consultation on the process and navigating different services. They can provide advocacy and coordinate those wraparound meetings I mentioned, and also link to other services. And we just have on the other side, Family Ties of Westchester is a organization that provides a lot of family and youth peer supports. They have family resource centers. I believe there's 4 of them throughout Westchester. They provide linkage to family peer advocate and youth peer advocate advocates, and also have support groups and parenting skills classes, and they also facilitate wraparound meetings for individual families. So you may see that you may have noticed that the word advocacy is all over this, because we find that our families tend to need a lot of assistance in terms of making sure that their children are getting what they need. So we feel that a large part of what we do is advocating for those services, whether they be mental health or school services that they need. The different kinds of services that are available in Westchester County are, as I said, the wraparound meetings. There's also outpatient or in-home individual and family therapy. There's family and youth peer support services, as I mentioned, crisis stabilization, care management, community-based in-home supports. There's also a cross-systems unit, which means that that's a multidisciplinary team made up of DCMH, DSS, I believe the court system, and a bunch of different systems that can help assist with the most at-risk and high-risk families that we have. And you can talk to staff here at DCMH about referring a family to the cross-systems unit. There's also intensive day treatment and children's day treatment programs, community residences, partial hospitalization, residential treatment facility, and of course, acute inpatient hospitalization, which that may be here or it may be at Rockland Children's Psych Center over in Rockland County. So who's eligible? So of course, everyone is eligible. Any family member, or you as the provider of service is eligible to get information from DCMH about a number of different things and services and applications and whatever it is that you may need. There are definitely some differences when it comes to Medicaid, that there are services that are available for youth that have Medicaid. If they don't have Medicaid, please call us anyway, because that's important for us to know, number one, but number two, there may be ways for other services to be put in place, or if we can help to make sure that they get Medicaid, if they're eligible to get Medicaid, then they can be open to some of these other services. And I just also wanted to mention that there is something in Westchester County called community networks, which are basically just what it sounds like. They are networks of providers plus might be library staff, might be law enforcement, might be planning folks from the various communities that get together to talk about resources and issues that have come up or patterns that they see. Our DCMH staff, Lindsay Rivera, works with all of these networks. So feel free to contact her if you'd like to be part of any of them. And this is our DCMH Children's Mental Health team. So Lindsay's information is there, as well as Tori Shaw, Danielle Pomeroy, and Shayla Aguilar. And our services are available in English and Spanish. Okay, so last but not least, our services and supports for individuals with intellectual and developmental disabilities. So the New York State Office for People with Developmental Disabilities, or OPWDD, is the entity that someone applies to in order to get eligibility for a number of services that you can really only get if you are approved by OPWDD. And the criteria is listed there. They need to have proof of a qualifying diagnosis, which there's a list of examples. It's not the list entire, but those are some examples. And the diagnosis originated before the age of 22 and is expected to continue indefinitely. And the qualifying diagnosis causes substantial deficits to a person's daily functioning, which may require the need for lifelong support. They also have established something called a front door, which the phone number is there, and front door staff are OPWDD staff that can help guide people through the steps involved to find out if someone is eligible for services with OPWDD. So that's a good number to keep handy. They may also be able to check for eligibility because, as I know we've experienced many times, particularly with our population of people experiencing homelessness, that they may have been enrolled in OPWDD services as a child, but due to life circumstances, et cetera, they didn't maintain contact with those services. And when that happens, OPWDD, like if they, you know, I think, I don't remember how long has to go by, but after a certain time, you like fall off their list, for lack of a better term. And so you need to either reapply or reestablish connection with services to be able to receive the specialized services that you can only get through OPWDD. One of those is, I'm sorry, before we get to those, there are also care coordination organizations, or CCOs. They were established over the last 2 or 3 years, I think, maybe a little more, and they assist families with the OPWDD eligibility process. And if found eligible, they can also provide the care management services to that person. So that's a really good service. In the old days, they didn't have anything like that, so people were really kind of on their own, or they would contact us here at DCMH to try to help to figure out if someone is eligible, and gathering the documentation and know what you need to do to provide sufficient documentation to be deemed eligible. And now they have organizations that can help people do that. The Westchester County DCMH Intellectual Developmental Disabilities, the different examples of the services and supports. If someone qualifies for OPWDD services, they can get care management, employment, day services, housing, assistive technology, as in like adaptive devices, community habilitation, which is sort of like skill building in the community, environmental modifications, so modifications to their home if necessary, crisis services, respite, and self-direction, which means that they can spend their service money on particular things that they feel are important to their for their treatment and for their services to meet their goals. So our team here is Michelle Armisto, who's our program coordinator for this unit, and Matthew Faulkner, who's our community work assistant for this unit. And they are available to answer questions and assist in this process, both of finding out if someone is eligible, how they can become eligible. They can also answer general questions about the services that are provided here in Westchester County. And specifically, one of the things that Matthew does is work with schools on school transition assistance for children and teenagers who have been enrolled in OPWDD services and have been approved for services, and sort of what the next steps after high school might look like. Okay, so what we can do, I don't know if well, we can leave that up, I guess, like that. So I was not looking at the chat. I don't know if we have any questions in the chat, or if people want to raise their hand to ask any questions, or feel free to put them in the chat, and Latanya and Allison will help me answer any questions that you may have. Thank you for still being here. I think everybody is still here at that start that we started with. The other thing I was hoping to do today is that I work very closely, obviously, with the COC still, and we would like to find out from folks what else they would like us to present on in terms of behavioral health services. If there's anything that you want a more in-depth, a deeper dive into any of these topics, we can do that as part of our education subcommittee through the COC. And it may not be a DCMH staff that does it, but we will definitely get folks to address topics that you guys are interested in learning more about.
Okay, so far we have 2 questions. The first question is, are we going to get a copy of the slides? I believe Annette said yes.
Mm-hmm.
The second question is, my question has to do with adult SPOA mental health versus non-mental health.
I think that's Medicaid versus non-Medicaid. Yeah. Thank you.
Okay, sorry.
Thanks for clarifying. No, that's okay. Okay, so let's think. Okay, so the adult SPOA application, as I said, if someone is in need of ACT services or housing services, or if they need care management services but do not have Medicaid, that's the appropriate application to do. And the reason being is that, what's the best way for me to explain it? Let me see if I can go back to that. That slide specifically, but the reason why we make that distinction is that, I don't know if there's any old timers like me out there, but we, oh, why does it do that? It started me from the beginning. I'm sorry, guys, hang on. Okay, so in the old days, there was only one kind of New York State Office of Mental Health case management. And it was called case management, and it had different levels: intensive and supportive, and then something we called reinvestment, which was non-Medicaid case management. Then, I don't know, it's got to be 10 years ago now, at least, or almost, New York State Department of Health took over the case management responsibilities and that whole program of any Medicaid billed case management type program. And what they've done, and they created the concept of the health home, which is not really a home. It's not even a place. It's usually an agency. It's kind of a misnomer. But the concept is that the person would be provided wraparound kind of services through this health home, where this care manager would be the hub of their wheel, making sure that they're going to all their appointments and doing everything that a case manager would do, although not as intensive as the different levels that we were able to offer before. And those are Medicaid billable. What was left is that we here at DCMH, through our SPOA, still had those, what we used to call reinvestment or non-billable Medicaid slots. So if the person doesn't have Medicaid, we can still provide case management for them or to them through our contracted agencies, but it has to go through a SPOA application. Now, they may not have Medicaid today, but the whoever works with them may get them on Medicaid, and then they can be switched over to a health home care management. Nearly all of our programs that have the non-billable also have the billable. So they can switch them in-house to billable if they get them on Medicaid. But if they never get Medicaid, that's fine. They can stay in the non-billable slot. So they're still getting the service. It's just it's not billed. I don't know if that answers your question. And if the person does have Medicaid, the way that you get them care management, if they don't have them, is to contact one of the health home agencies or the New York State Department of Health. I can try to figure out who the best contact would be for that, just to find out where people might be already enrolled. Because like I said, the way that the New York State Department of Health rolled out health homes is that they basically took information from the Medicaid system and figured out which folks would qualify for health home and sent them like outreach letters and assigned them to programs. And so then it was up to the provider who would get these lists of people to contact so that they could start working with them and billing for them, et cetera. But of course, if you weren't found, then you weren't accessing the service. So if I remember the whole rollout that we were telling people, make sure you open your mail, make sure you look at, who you're assigned to, because they also had an enrollment period that if you didn't want to work with, provider ABC, you could enroll in a different health home with provider XYZ, but you needed to let them know by a certain date. Otherwise, they were going to auto enroll you into a care management program. So now that that's been happening for years, we have plenty of people who you can, when I look them up in the system, I can see that they were assigned to someone, but they never received the services, or they maybe got an outreach call, but they never got any other services after that because they probably couldn't be found. So that's basically how to start. So, but even if they have been enrolled with someone, and that's what DOH says, they can work with another health home. That health home just has to appeal to DOH to switch them. But if you have questions about that, just call us. And then we can work on very specific individuals as opposed to kind of talking generally.
So there's a follow-up question. Is health home voluntary?
Yes, it's absolutely voluntary. I mean, they kind of mass enrolled people, but if you didn't follow up with the referral, then yeah, it's absolutely voluntary. Are there any other questions?
No questions are listed in the chat.
Okay. Are people able to unmute themselves? Because I don't mind if they talk too, if they can't type. I'm always the person who's like typing as the as the webinar is ending, because I don't type very quickly. And yes, we are getting copies of the slides. What I don't know is whether we would be, and I don't know, LaTanya or Allison, if you can answer this, do the slides get connected to the video so that if they go to the video, the slides will be a link, there'll be a link to the slides from there, or do we email those out?
They will be posted on our webpage, and there will be a link to the slides on our YouTube channel that will direct to the webpage.
Thank you, Allison. Yeah, so LaTanya, I saw that other one. I saw the other question. So this question about agencies that will assist individuals to receive OPWDD. They are the, I'm going to go right to them because I don't want to say the wrong thing. There are, they are care coordination organizations, which you can call us here at DCMH to find out exactly who those are. Or you can probably Google Care Coordination Organizations, OPWDD, and they'll come up as well. Or you can start at that OPWDD front door phone number and try them first. They help with the OPWDD eligibility process. I am not entirely sure that they help someone to obtain a psych eval or a psychological testing evaluation in that process. So they may be able to refer. My guess is they don't do it directly, but they may be able to refer someone somewhere for that to get done. My guess is that they more help with the navigation and understanding the process and how to help, sort of point people in what the kind of documentation they're going to need to prove their disability.
Okay, the next question is, can we receive a list of peer and non-clinical programs and their contact information?
Yeah, that's I can try to do that, but that's all in our directory, our online directory. One thing that one of my goals, hopefully before the end of the year, is to modify our online directory, because right now we have the services and the programs, when you search for them by the type of service, it goes by the disability. So there's mental health, there's intellectual and developmental disabilities, there's SUD, but I would like to add one that's just peer and non-clinical. That would be, I think, a good thing to add, so that if people are just searching for those. But in the meantime, if you search mental health programs, you can search them by location, or you can, yeah, that's probably the best way to do it, would be to search under mental health and do a search, and you would get a lot more than you probably need, unfortunately, but those peer services would be also in there. But I'll also make a note to myself and see if we can put something together that we can send out. Anything else?
So far, there's no additional questions.
Thanks, Allison. So like I said, our biggest thing is to encourage you to contact us. And, as questions come up, or as I'm sure you'll have very individual and specific questions that hopefully we can work with you, with individuals and families that you guys are working with. I'm just making sure. Okay. Okay, so thank you, everybody. Have a great day.
Thank you.
Thank you. Have a great day.